Every tooth has a story to tell. But sometimes that story is a real mystery, a case of some unexplained pain or discomfort. In endodontics, figuring out what's really going on, well, that's everything. It's kind of like being a detective. You're gathering all these little clues to solve the case before you can even think about the treatment. So let's dive into how it's done. So how do you get from a patient just saying, it hurts, to a really clear, actionable diagnosis? It is definitely not guesswork. It's a systematic investigation, a step-by-step process of figuring things out and confirming your suspicions. And the goal isn't just to find the culprit, but to get it all down on paper, precisely. And that brings us to the main objective of this whole investigation: filling out the endodontic record and filling it out correctly. Think of this document as the official case file. Every single piece of evidence we gather gets meticulously recorded right here, which then leads us to the final verdict and, of course, the right treatment plan. Okay, so our investigation doesn't start by looking at the tooth. Nope. It starts by listening to the patient. This first phase is all about gathering that initial intel, the background info that really sets the scene for our entire case. We start with 3 really fundamental steps. First up, the medical history. Are there any other health issues going on? Second, the dental history. What's this tooth's backstory been like? And third, and this is a big one, the key questions. We ask the patient to describe the pain. What sets it off? How long does it last? This is their testimony, and it is absolutely crucial. All right, once we have the patient's story down, it's time to move from questioning to the physical exam. This is where we get hands-on. We're going to apply specific tests to see how the tooth and all the tissues around it react. And this is where the clues start to get a lot more specific. To get those specific clues, we've got a whole detective's toolkit of clinical tests. And there's a whole bunch of them, from checking if the tooth is wiggly to testing how sensitive it is. Each test is designed to get a response that gives us another vital piece of the puzzle. Let's just look at a couple of the most common ones. First up is percussion. Now, this sounds fancy, but it's simple, and it tells us so much. We're just gently tapping on the tooth. What we're doing is checking the health of the periodontal ligament. That's the tissue that holds the tooth in place. Is it inflamed? Is it sensitive? If the answer is yes, that points us towards a problem with the tissues around the tooth. Next, we've got palpation. With this one, we apply some firm pressure on the gum tissue right over the tip of the tooth's root. We're feeling for any sensitivity or maybe some swelling. This test gives us direct info about what's happening right at the root's apex, deep down in the bone. So we've got the testimony, we've run the physical tests. But to really crack this case wide open, we need to see what's invisible to the naked eye. We need to get a look inside. And for that, it's time to bring in the heavy artillery of diagnostics, the radiograph. This is often the moment of truth. That first X-ray is probably our single most important piece of visual evidence. But, getting good evidence means you need good technique. Using something like the parallelism technique is crucial because it makes sure the image is accurate, giving us a true-to-life picture of everything going on. Now, when we look at this evidence, we're not just giving it a quick glance. No, we follow a strict checklist. We analyze the pulp chamber and the pulp canal, the very heart of the tooth. Then we check out the periapical zone. That's the area around the root tip. And finally, we write down a detailed description of anything that looks off. It's a systematic search for clues, Okay, let's see how this all comes together. After we've collected all the evidence, the history, the clinical tests, the X-rays, we are finally ready to deliver the verdict. But here is the key thing to remember. It's not one verdict. It's 2 separate but totally interconnected diagnoses. And this is so important. First, we have to figure out the pulpal diagnosis. This tells us about the health of the nerve and tissue inside the tooth. At the same time, we have to determine the periapical diagnosis, which describes the health of the bone and ligaments surrounding the tooth's root. Think of it this way. One is the problem inside, the other is the effect outside. For the pulp, the diagnosis is going to fall into one of these categories. It's kind of like a spectrum. On one end, you've got a normal pulp. Then things can get irritated, which we call reversible pulpitis. It's mad, but it can still heal. The real turning point is irreversible pulpitis, where the damage is just too much. And if that's left untreated, it can lead to pulp necrosis, which just means the tissue inside the tooth has died. Each one of these points to a very different path forward. And it's a similar story for the periapical tissues. We have a specific set of classifications here too. This tells us how the area around the root is reacting. We might find normal apical tissues, which is great, but if there's inflammation, it could be symptomatic apical periodontitis. That's the one that really hurts when you bite down. If things progress, you could get an acute apical abscess, which usually means swelling and some serious pain. Pinpointing the exact condition is just essential.
So, the detective work is done. We've talked to the witness, we've run the tests, we analyzed the evidence, and we've reached our 2 verdicts. So now we come full circle, right back to the whole point of this entire process.
And this is it, the final step. All that information, every single test result, every observation, it all allows you to confidently and correctly complete that endodontic record. It's such a critical piece of the puzzle. 1 tooth, 1 complete case file. This makes sure that whatever treatment comes next is precise, justified, and absolutely the right call.
And that is how you solve the dental mystery. By following this structured path, you turn a patient's vague complaint into 2 specific, definitive diagnoses. The case is solved, the record is complete. The only question left is, what's next?